afternoon, everyone. I'm Whitney Jones, and today I'm going to be demonstrating how to perform a full comprehensive assessment on a patient. So I'm going to start off by first washing my hands before I walk in the room and introducing myself to the patient. Good afternoon, my name is Whitney, and I'm going to be a nurse practitioner today. And I'm going to be doing a full assessment on you. Are you okay with that today?
Yes.
Is that what you came in for?
Yes.
Okay. So I'm going to first check for the patient's level of consciousness. So I'm going to ask him some questions. Could you tell me your name?
Email Paul.
And could you also tell me your date of birth?
10/13/1989.
Could you tell me what day it is today?
Friday.
Okay, and also could you tell me what month we are in?
April.
Okay, so the patient is oriented time 4. The next thing I'm going to do, I'm going to assess patient's skin. So just looking at the patient and making sure that there's no cuts, bruises, or just any abnormalities on the skin. So just looking at the patient, I just noted, so I could just note like a scar on the patient's elbow. But for the most part, the patient's skin looks clear. There's no rashes or anything like that. Overall, the patient's skin looks intact and looks good. Next thing I'm going to do is I'm going to inspect the patient's head. So just looking to see if I see anything that's abnormal, any masses, lumps, bumps, any asymmetry in the patient's head. I see none. I'm also going to be inspecting the patient's hair. There's no lice, there's no dandruff or anything odd or abnormal going on with the patient's hair. The hair looks healthy, it doesn't look dry, it doesn't look brittle or anything like that. Next, I'm going to ask the patient to clench his teeth, if you may. So just kind of clench your jaw. And I'm just going to be palpating the patient's TMJ. Okay. So that feels pretty normal as well. The next thing I'm going to also do, I'm going to test, and I was testing the patient's cranial nerve 5. And I'm also going to tell him, could you move your jaws for me? Like just kind of open him out, like move his jaws. Okay, so I'm pretty much testing his cranial nerve 5, and that works. His facial movements, I'm also going to be testing his cranial nerve 7. So I'm going to ask the patient to raise your eyebrows. Okay, can you make a frown for me? Can you smile? Okay, and can you puff out your cheeks? Okay, so patient's cranial nerves and the face are intact as well. The next thing I'm going to do is test the patient's extraocular movements. So that's testing the other cranial nerve 3, 4, and 6. So I will ask the patient to follow my finger. So just look at my finger with your eyes, and patient's gonna follow my finger. Okay, so patient's cranial nerves, extraocular nerves are intact. Next, I'm going to pull down the patient's eyelids, and I'm going to be pretty much looking at his sclera, looking at his conjunctiva. It looks good. It doesn't look like he has any infections or anything. And the whites of his eyes are white. There is no redness or anything like that as well. The next I'm going to perform an appropriate fundoscopic exam. So if I had my ophthalmoscope, I would go and I would check his fundus in the back of his eyes, and I would make sure that there is no abnormalities in that area. The next thing I would do is test his pupillary reaction. So if I had a pen light, I would pretty much just check the patient's pupillary reaction if I had a pen light. So that will conclude the head and the face as well as the eyes. So next I will also check his auditory acuity. So I will stand 2 feet behind the patient, and I will whisper a combination of 3 letters and 3 numbers, and I will see if the patient can hear me. So when I whisper 3 things, just let me know if you can hear me, okay? 2, 3, 8. Could you repeat it back to me when I whisper to you?
2, 3, 8.
Perfect. So the patient's auditory nerves are intact as well. and that was cranial nerve 7. Next, I'm going to perform a external ear exam. So I'm just looking at patient's ears, and there's nothing abnormal about his ears. There's no wax or anything like that coming out. No discoloration or anything like that. His ears look good. And just noting that he does have little piercings, but that's pretty much it. There's nothing going on externally with his ears. Next, I'm going to do an internal ear exam. So I have my speculum, and I will look in both of his ears, and his tympanic membrane will be pearly gray, like a pearly gray white color, and that will show that there is no sort of wax impact. Yeah. Next, I'm going to test his olfactory sensation. So I will get something for him to smell. And could you smell this for me? It's vanilla, okay? What does that smell like?
Vanilla.
Perfect. So it is a vanilla candle, and his olfactory sensation is intact because he was able to smell that. The next thing I'm going to test is a nose exam. So I'm just going to palpate the patient's sinuses. Do you feel any pain or anything upon me palpating?
No.
Okay, so the patient doesn't feel any pain, so that's a good thing. The next, I'm going to inspect and palpate the patient's lips and gums. So just looking at the patient's lip, there is no dryness, no crackness. They're moist, and I'll ask the patient to open your mouth. Okay, patient's gums are moist, pink. The mucosa in the mouth is moist and pink. There's no lesions or anything like that in the patient's mouth. Okay. Okay, so I'm going to inspect the patient's teeth. I'm noting that the patient has braces. There's no dental caries or anything like that. There's no discoloration. The patient's teeth look pretty healthy. They look nice. Next, I'm going to assess patient swallowing. So, could you swallow for me, please? Okay, so the patient swallowed, and I felt that he did perform that, and there was no difficulty with him swallowing or anything. Next, I'm also going to check the rise of the patient's palate as well as the gag reflex. So if I were to check his gag reflex, I would just have a little, just something to just put in his mouth and see if he gags. And also, could you say, open your mouth and say ah?
Ah.
Okay, perfect. So I did note the rise of the palate with him saying ah. Next, I'm going to inspect the tongue. So if I were to inspect his tongue, I would ask you to stick out your tongue, and I would also have something that I could hold his tongue, and I would check each side, make sure there isn't any lesions, any ulcers, or anything like that on the patient's tongue. The patient's tongue is moist, pink. There is no discoloration. There is no lesions or anything like that on the patient's tongue. The next thing I'm going to do, his tongue was also symmetric as well. The next thing I'm going to do, using the light, I'll inspect the patient's soft and hard palate. I also inspect his uvula and his tonsils. So if I had a pen light, I'll ask the patient to open his mouth. And with the light, I would inspect everything. Could you put your tongue down for me, you think? No, put it down. So I inspected it. His tonsils, there is nothing on his tonsils to suggest any type of bacteria or any type of abnormalities. So overall, the patient's inside of the patient's mouth is within normal limits as well. There's no abnormalities. Next, I'm going to inspect and palpate the position of the patient's trachea, and his trachea is positioned in the middle. Next, I'm going to also palpate and the bilateral lobes of the thyroid standing behind the patient. So the same way I just palpated the trachea, I'm going to palpate his lobes, and I might as well do the thyroid because you could do the thyroid like this as well. Okay, so that's what I would do. That's that. So next I will check his lymph nodes. So his periauricular, I'm palpating those, and that's pretty much on the side of his ears. That's the periauricular lymph nodes. Next, I'll palpate the submandibular lymph nodes, and that's right up under here. And then the subclavicular nodes, and that's in the clavicle area. All right. So next, I will inspect his chest and assess for respiratory effort. So just looking at the patient's chest from where I'm standing, he's not, there is no retractions. He doesn't have any difficult time breathing. It looks symmetrical. His respirations, breathing in and out, it looks symmetrical. So I'm going to inspect his lips for cyanosis and nail beds for cyanosis or any clubbing. So his nail beds are red, there is no cyanosis or anything like that. I'm also just going to press down, and there is negative less than 3 seconds. The color is coming back in his nails, and his lips are pink. There is no cyanosis on his lips as well. The next thing I'm going to do, I will auscultate his chest wall. So I will take my stethoscope and I will auscultate the patient's chest. So I'll just go from where I'm standing, I can just go from side to side down into a ladder position. So I'll just listen and tell the patient, could you breathe? Could you take a deep breath in for me, please? And let it out. Again. 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 And I would just find all the areas of the lungs, and I would do that on the front of the patient, and then I would go behind the patient, and I would also auscultate all of the lobes of the lungs in a ladder position on the back of the patient, on the patient's back as well. And that would conclude testing for the lungs, and his lungs are clear bilaterally after that test. The next thing I will do is I will inspect for his apical impulse, pulsations, lifts, or heaves. So the patient would be sitting, and I will be inspecting his apical pulse, making sure that I don't see any thrills or anything like that. And I'll also check for, I will have the patient lay on a 30-degree angle. I will check for JVD as well. And I will also, in order to check for his apical, I have him laying on his left side. And I will also auscultate with my stethoscope the patient's apical pulse as well. Let's see. Also, on a 30-degree angle, I will palpate for any lifts, heaves, or thrills, or anything like that in the patient's apical area also. Let's see. So, in order to palpate the intercostal spaces and Erb's points and all of the little areas of the heart, the patient will be at a 30-degree angle laying down on the examination table to inspect that. So the next thing I would do is I will auscultate the 6 relevant areas with the diaphragm of my stethoscope on the patient. So I will use my stethoscope, and I will just auscultate all of the areas of the patient's heart. And I'll be listening for any murmurs like S1, S2, mitral cyanosis, aortic regurgitation, are just a few examples of what I'll be listening for. And the patient's heart, there are no murmurs and it sounds normal. I will also, if I were to, I would place the patient in the left lateral decubitus position, and I will be listening for mitral cyanosis with the bell of my stethoscope. The next thing that I would do would be having the patient, in order to check for like aortic regurgitation, I could have the patient sit up and just lean forward for me, and I would also assess for that and listen with my stethoscope. And just lean forward. Okay, and it sounds normal as well, within normal limits. I would also place auscultate bilaterally for any bruits in the carotid, renal, iliac areas, and I would use my stethoscope to do that, and I heard no bruits or anything, no throughs or anything like that in those areas. I would palpate his carotid arteries, so I'll just palpate all your arteries. So let me see. Alright, and let me check your brachial arteries. Okay. Perfect. And they're felt, and I don't feel any abnormalities in his carotid arteries nor his brachial or radial arteries. It all feels like it's flowing smoothly. Next, I will palpate radial, so I did those. Femoral arteries, so I would also palpate the patient's femoral arteries as well, along with that exam. I'll check the patient for any abnormal hair growth. I also checked his capillary refill already, and like I had said earlier, it was less than 3 seconds. The color came back. I'll check for any leg edema or just any edema in the patient's legs, and there is no edema, so that's a good thing as well. That's normal findings to have no edema. I would check his abdomen. So I would have the patient lay down, and I would inspect first, then I would auscultate, and then I would start the palpating and percussion. So I would make sure that I inspect, make sure that his abdomen, there's nothing abnormal or anything like that. Then I'll auscultate, and yes, his bowel sounds are normal active. And then I will start palpating and percussing and making sure that everything just feels normal. There's no sensitivity and no pain when I'm palpating, and that there's no masses or anything. So after that abdominal exam, everything does feel normal, and the patient doesn't have any sensitivity or anything down there, and his bowel sounds are also normal active. I would check for the patient's the aortic branch in the abdomen as well. I would listen for that as well. I would palpate, and I would also auscultate and make sure that that sounds normal also while I'm doing the abdominal exam. Next, I will check his, if I needed to do a genital urinary exam, then that would be done along with that assessment as well. And asking the patient about his bowel sounds, or his bowel activity when he's at home, just different things like that. so finishing up the exam, going towards the end of it, I will also be inspecting the patient's neurological process as well. So that can consist of tests, but also just a general conversation with the patient. And just having a conversation with the patient, I can see that the patient's neurological process is intact. Next, I will also be assessing patients' extremities and looking for any type of signs of muscle atrophy or anything like that. But the patient's muscles, they look pretty symmetrical bilaterally, as well as the legs. There's no signs of muscle atrophy or anything like that. I would also test the patient's muscle strength. So could you squeeze my fingers? Okay. Can you push me away? Alrighty. So the patient's upper muscle extremity, the patient's upper extremity muscle strength is intact. It's 5 out of 5. The patient's leg, can you fight against my leg? About the my hand? Okay, what about this one? Alright, and then the same here, and then here. Okay, so the lower extremities, the muscles are 5 out of 5 as well as far as muscle strength. Next, I will test the patient's deep tendon reflexes, and I will have something and I'll be able to test his reflexes, and his reflexes would be intact as well. And I will also test the reflexes of his lower extremities, and they would be intact. Next, I will test the patient's coordination and gait. So I will ask the patient, could you take your finger and touch your nose? Okay, and I'll also ask you to stand and do a tandem walk. So if you could just put one foot in front of the other and do a little walk as well. Perfect. So the patient's coordination and gait is intact also. I will also check the patient's sensory system. So I would use objects and different objects like sharp or temperature or anything, and I'll check the patient's feet and see if the patient has any sensation in his feet. And if I do that with this patient, he will have those sensations intact. I will check the patient's cervical, lumbar, and thoracic spine as well in this inspection. And I will also check shoulder strength. So could you shrug your shoulders up against my hands? Perfect. So the patient's shoulder strength is also intact as well. I would inspect the patient's wrists, hands, and fingers. I would make sure that there isn't anything abnormal, no signs of arthritis or anything like that on the patient's hands or wrists. And I will also go down and I will check the patient's ankles and feet. There's no signs of edema or anything like that. No pit and edema, no abnormalities, no sores or anything like that on a patient's wrists, legs, ankles, or feet. I would also inspect the patient's joints and the mobility of his hips and things like that. So I would ask the patient to do some extending. I'll have the patient lay down and extend the joints, flex, and just different things like that, and testing to make sure that his upper and lower extremity joints are intact, which they will be upon evaluation. I'll also check the patient's knees also, making sure that that's intact as well, and check his feet also. And that will conclude the end of this comprehensive assessment. I hope you guys enjoyed. Thank you. All right, bye, patient.